Okay everyone, so in this special opportunity, I will explain the next topic is about consultations. So I believe that everyone is familiar with consultations, especially for those who are in majoring nursing academy, and I believe that you are not strange anymore. So you often face the conditions that you have to consult something with the patients. But as we know that the common way usually people know consultation is between the doctors and also the patients. But here consultations means broad actually. It can be between nurse and also the patients. So consultation is a basic skills that should be had by every nurses, or especially the candidate of nurses. In this case, it should be in the form of English because the subject is English. Who knows that for you all that you will work abroad later. You will work at the overseas hospitals maybe. So or in the international hospital in Indonesia itself. So I think this is very useful for you are, or you will face the foreigners patients. So you are not shocked anymore to face these situations and conditions. So everybody, when we talk about consultation, it doesn't mean it just related to the language that we have, but it's also followed by good attitude by ourselves. So polite language and also good attitudes also the big importance points for you all. So I want to talk some abbreviations that you usually face in the consultations. For example, like BID is for twice a day, and also TID 3 times a day, and then AC before meal, and PC after meal, and PO for oral or orally, and BP is for blood pressure, and also TPR is for temperature or pulse. So there are many more abbreviations in relating to the first uh, consultations, especially it is related to the vital signs. All right, everyone. So there are common questions that is produced by the doctors and also the nurses. For example, like where is the conversations take place, and also uh, what is your complaint, sir? What is your complaint, sir? What brought you here? What's troubling you, sir? What can I do for you, sir? What seems to be the problem, sir? I can't see anything wrong here, sir. I don't think there is anything to worry about. I think everything is all right. So these are the examples of common questions that usually mentions by the doctors and also the nurses in English. I can give you one of examples of conversations between the doctors and also the patients in relating to the consultations. For example, like between the doctor and the patients. It is between the Dr. A and also Mr. Brown. Please have a seat, Mr. Brown. Thanks. Well, Mr. Brown, what brought you here? I have temperature drop. I see. How long has this been going on? Since 2 weeks ago. Is your temperature comes at particular time? Yes, I usually get fevers in the afternoon. Do you have any else complaints, sir? Yes, I have headaches, sir. What about your appetite? Do you have it? Yes, but sometimes I don't have it at all. Okay, Mr. Brown, I'd like to examine you now, and can you lay down on the couch, please? No problem. And would you like to put your clothes up, please? Okay. Mr. Brown, well, I don't think there's anything to worry about. Maybe you just feel tired and so on. So this is the examples of short conversations between the doctors and also the patients on the consultations. So what you have to do now is, I hope that everyone can make a dialogue and make a short conversations on the in the terms of consultations in English. So good luck everyone. Hopefully this video will help you and will give you much little less or more informations about consultations in English. Thank you very much. See you everyone.